Greece. The floor is yours.
Thank you very much, Chairperson. Dear ministers, dear colleagues, Ministers Lavrov, Minister Arujo, and Minister Jaishankar, and our chair, our colleague, Minister Wang Yi. I'm very pleased to see you, colleagues, and to wish you continued good health as well as safety in this very challenging period. I'm pleased to be part of this timely discussion as we explore new opportunities to strengthen our coordination and cooperation on how to tackle this COVID-19 pandemic, which is impacting on the entire global community. We are living in the most extraordinary times, and I wish to thank our BRICS chair for convening this important meeting. Today, the world is confronted once again by a virus that threatens global devastation. Our people expect us to find an effective set of solutions to this significant challenge. I believe we can find these solutions through cooperation and coordination, and through ensuring that our efforts together address the pandemic, which is having such dire economic, social, and developmental effects on all of us and the regions that we live in. We believe as South Africa that international cooperation and coordination is absolutely non-negotiable. We have to join efforts to find a vaccine and a cure for COVID-19. It is for this reason that South Africa has joined the international call for support and strengthening of the mandate of the World Health Organization as it continues to coordinate and guide global efforts to combat the pandemic. As a country in a region that continues to rely on the assistance of the WHO to supplement national efforts, we are deeply concerned about the current politicization of the work of the organization. We are particularly disconcerted about the withholding of funding at this critical time, and we thank and congratulate all countries that have come forward and increased their support to the WHO in this difficult time. We believe withholding of funds will impair the ability of WHO to provide the much needed help in developing countries and in particular in Africa. We strongly condemn any stigmatization or discrimination of countries against persons or individuals with respect to COVID-19. At the same time, as South Africa, we wish to stress that there is no place for racism and xenophobia in respect to responding to the pandemic. And we emphasize the need to fully respect human rights and a gender-inclusive approach in ensuring that we address the most vulnerable in our societies, including women and girls, who are at the center of the COVID-19 impact. Like many countries, South Africa remains on lockdown as part of the national disaster declared by President Ramaphosa to curb the spread of the virus. The cost to our economy and the impact on the lives of our people have been catastrophic, but we are seeing the saving of lives through these drastic interventions. We have developed a comprehensive economic stimulus package in partnership with all stakeholders in our country. The package provides relief for businesses, for employees, for the small and medium-sized business sector, from the most vulnerable who are in distress and hungry, All of these form part of our relief efforts. As chair of the African Union, we are working closely with the African Union Commission and leaders on the continent to develop economic recovery responses to the pandemic and its effects. We have benefited significantly from the continued solidarity of our partners, particularly our BRICS friends, in providing assistance to us as South Africa and broadly to the African continent in general. This support has taken various forms that have sought to mitigate both the short and the long-term consequences of the pandemic, and we sincerely appreciate all the support that has been given to our governments and to the people of Africa. We believe that one of the matters we must address as we address this crisis is to ensure that access to medicines is enjoyed by all persons, in particular access to essential medicines and diagnostic tools, which must be affordable, safe, effective, and of high quality. This constitutes a fundamental element in progressively achieving the full realization of the right of everyone to enjoy the highest attainable standard of physical and mental health. We thus support the call for collective action on research and development of medicines, diagnostic tools, and health equipment. We believe that BRICS should rally support for intergovernmental and institutional efforts to deal with the crisis. In this regard, we believe more needs to be done to improve cooperation in New York, in the United Nations system, in support of efforts for enhanced coordination and a comprehensive approach in a transparent and inclusive manner. We support as South Africa a science, technology, and innovation response to COVID-19 and believe that there are several opportunities for collaboration regarding data exchanges, as colleagues have said, monitoring of the pandemic and its effects, therapy, drugs research, diagnostics innovation, and social science development. We believe there's an urgent need to increase the production of critical medical supplies and equipment and to provide affordable access to the requisite technology and concrete assistance, particularly to developing countries and the least developed countries in specific. In this regard, we are most encouraged to see focused cooperation emerging within the context of science, technology, and innovation, and in the health tracks of BRICS and the New Development Bank. We also believe that the current experience provides justification for the need to accelerate the establishment of the BRICS Vaccine Research and Development Center as agreed in the 2018 Johannesburg BRICS Declaration. South Africa supports and welcomes the efforts of the World Health Organization and medical researchers around the world to develop vaccines and treatments which should be accessible, available, and affordable universally. We call for the expansion of global manufacturing capacity to meet the increasing need for medical products and equipment to cope with the pandemic. Indeed, we need to ensure rapid availability of essential medical supplies and pharmaceuticals at affordable prices and on an equitable basis. We encourage BRICS countries to support the call of WHO that we should pool rights and pool technologies that are useful for the detection, prevention, control, and treatment of the COVID-19 pandemic. We fully commend the UN Secretary General's global humanitarian response plan to fight this pandemic, particularly in vulnerable countries, and the COVID-19 Response and Recovery Fund to help scale up integrated support to low and middle income countries, as well as the Secretary General's call for ceasefires in conflict-ridden areas and for an end to unilateral sanctions and to allow all countries access to care and support. Furthermore, we welcome cooperation within the G20, particularly with regard to support for Africa and a stimulus package as requested by all African countries under the auspices of the African Union. We are severely concerned about the potential impact of the virus in developing countries, and especially on our continent, where countries suffer from severely under-resourced health infrastructure. The economic impact on Africa is going to be severe, given its dependence on imports of medical equipment and supplies, basic products, and its high vulnerability to trade disruptions and restrictions. Measures taken by developed countries should not cut off Africa, and indeed all developing countries, from critical supplies. All sectors of society and governments should put into practice a belief in our common humanity for the eventual greater good of the global society, of all lives and all livelihoods. We call on all BRICS members to provide support for Africa and the African Joint Continental Strategy, the African Centers for Disease Control and Prevention, and the AU's COVID-19 Response Fund. We also believe that safeguarding the global economy will require enhanced collaboration to manage debt reduction and ensure sustainable economic recovery, and to rebuild national production capacity once the pandemic eases. We have noted the UNCTAD proposal for a four-pronged strategy that could begin to translate expressions of international solidarity into concrete action. While measures are under consideration by the IMF and the World Bank, we are of the view that the UNCTAD proposal offers a clear perspective of what is likely to be needed by developing countries. In conclusion, colleagues, South Africa recognizes that the BRICS chair is in a very challenging situation, having had to postpone and in some cases cancel meetings. We are really encouraged by the creative leadership shown by our chairperson, Minister Lavrov, which has ensured that BRICS work continues even under these conditions. We wish to reassure the chair of our support and our confidence as you continue to guide us all in maintaining impetus through adaptation to the current challenges. We fully support a statement that would articulate the key aspects we have elaborated during this meeting. When future generations consider the story of this experience we are all going through, I am confident that they will do so with great pride in the innovative ways in which we as BRICS overcame this dramatic challenge by working together efficiently in solidarity. I thank you once more, dear colleagues, for this opportunity, and I congratulate the chairperson for drawing us together in this way. Thank you.